This is the static BENDEASE splint. So we're gonna teach you how to put it on and off and take care of it properly. The first thing to talk about is skin check. So we wanna make sure that we look at the veteran's skin before and after applying the splint for any signs of redness, irritation, any wounds, discoloration. You wanna check for blanchability of the red spots. And if there is anything that gets noted on the skin, please note that in the chart and also notify the clinician who both prescribed the splint and the physician so they're aware. If you note anything, I would recommend not to put the splint on and notify us ahead of time. If the skin looks good, you can go ahead and apply the splint. Typically, these splints, they will have a thumb that you'll know which way it goes. So this one's a left-hand splint. You would position the hand in the splint first, making sure that the finger separators are in place and in the web space, and the fingers are all the way forward on the splint. Then you go ahead with the first strap, which should always be the wrist strap, the primary wrist strap. And then going along with the secondary forearm strap. And then we progress to the hands. So the first strap is gonna be across the main knuckles of the fingers. And we do that kind of at a diagonal. And then the second strap is gonna be across the fingers right in the middle. And the last two straps are gonna be at this thumb. So the thumb should be nice and placed on the splint. And in the end, they kind of look like this.
And then to make sure the straps are appropriately tight, you would make sure that you can insert 2 fingers underneath the straps. You don't want it too loose because that would allow the splint to move throughout the night, but you don't want it too tight, of course, because we want to avoid too much pressure. So you want to make sure you can do the 2-finger test underneath each strap, and that looks good.
Once you're finished with all the straps, if the hand you note has shifted back or forward, you want to start the process again. You don't want to just leave it there. So if the fingers have shifted off of the splint, or if they've shifted very far back on the splint, you want to just remove all the straps and start again to make sure that it's in the right position. The other thing to note is that this base of the splint is movable and adjustable. We don't want anybody to adjust the angles of any of this, so just leave it how it is, but make sure you handle it with care. You don't bend or cause any aggressive movement to it to cause the shape of the actual splint to change. Okay, so taking it off. The strap order doesn't really matter for taking it off, but every time we remove a strap, we want to fold the Velcro back over onto itself so that it doesn't adhere to anything around the room or the splint itself. And after you remove, we want to check the skin again for any redness, irritation, or signs of wounds or discoloration.
If you note any changes to the skin, please discontinue the splint and notify the primary OT who prescribed the splint.